in, but we'll get started. My name is Judith and I'm from the British Red Cross. It would be good if you could turn your cameras on. That's up to you if you don't, but the more active or interactive you are, the better, or the better the better the experience for you. James Martin is looking as though he's somewhere very exotic. I wish I was there too. I'm sitting in front of my Red Cross sign. Behind me is my scruffy spare room, the box room. Let me just share this again. And it will now change to community education first aid, which hopefully is why you're all here this morning. Community education is my department in the Red Cross. We teach lots of people, groups with, volunteer groups and community groups and schools. And we're here to talk about first aid. So today I'm asking you to treat this as a normal workshop, etiquette, etc. I don't ask you to raise your hands like digitally. Some people don't know how to do it anyway. But I do just warn you, there's only me. So if you're talking over somebody, I won't hear you. And also, I will watch the chat if any of you can't use the speaker for any reason. But again, there's only me watching the chat as well. So hopefully we will get through it. Anyway, first aid. I'm going to just play this video about the Red Cross, just so you know where I'm coming from, why we're here.
The British Red Cross is part of the world's largest humanitarian network, the International Red Cross and Red Crescent movement. We work with the International Committee of the Red Cross, as well as the International Federation of Red Cross and Red Crescent Societies. Here in the UK, every year we help over 9,000 people affected by emergencies, providing everything from sandbags and supplies to emotional support. And when crisis forces people apart, we help bring them back together. Last year we helped reunite over 2,000 refugees with their families. Each year we help nearly 70,000 people live independently, helping with things like getting them home from hospital. Or if they're lonely, we'll pop in for a brew and a biscuit. We also teach first aid to nearly 150,000 people a year, putting more lifesavers on our streets. All of this and everything else we do is down to one thing: kindness. Find out how we can help you share yours.
Kindness. We are...
The British Red Cross is part of...
We in the Red Cross are bound by the fundamental principles that were given to us so many years ago. We have to abide by these. If we break any of these, we can no longer be the British Red Cross. And those are the sort of rules we live by. But also, if you use the word kindness, it sort of covers them, rather than going into what they all mean today. If you want to know more about that, you can find it at redcross.org.uk. Kindness. So at the end of the workshop, we want you to feel more confident, more willing and more able to help someone in a first aid emergency. Obviously in an hour and a half, I can't teach you loads and loads of first aid, but I can teach you the very important basics. And so we are also aiming to make you more confident and more willing to help. First aid starts very, very easily. What is first aid? Does anybody want to tell me?
Oh, hello. Can you hear me?
I can hear you, Darren.
Hi. Hey. First aid. Is first aid, I might get my words twisted, but is it just responding to, it's not dealing with the situation then and there, but giving aid, like literally it's in this title, like first aid, you being there and giving aid
Yeah,
as much as you can to support the situation.
absolutely. Well, the reason we ask this question, which may seem oversimple, is because some people think that first aid means you're a paramedic, a brain surgeon, and everything else in between. And you don't have to have loads of knowledge. It's good to have some basic knowledge, especially in severe emergencies. But anybody can do first aid. Right this minute, if you've never done a course before, you can do first aid. Because first aid is exactly what Darren said, or in our words, help given to a sick or injured person until full medical treatment arrives. If you walk up and say, hello, are you all right? Can I help you? You've actually started first aid. You've started. You've let them know somebody's there, that they're not on their own. Hopefully they can start breathing a little bit more deeper, that they can stop panicking. You started first aid. But we'll find a few more things that you can do as well, other than just say hello. The purpose of today, as we said, is to make you more willing. Now, if you read through this slide, you might recognise or remember some of the wording because it was put in during COVID. And the reason it was put in was because on a first aid course, we always talk about your safety. You are very important because you are important. I'm not here to teach you to get injured, but you are also the person there that can get help. The other person's injured, ill, frightened. You're the one that can get help. So you need to look after yourself as well. We don't want any brave heroes injuring or worse. We want you to be safe. And in the past, when we've talked about safety, quite rightly, we've talked about things like checking, if it's an electrocution situation, checking the electrics off. In your panic, grabbing the patient means you will get electrocuted. Turn off the electric first.
Hello. Sorry, could I just interrupt?
Yeah.
Could you put the volume up, please?
I can't turn the volume. It's up how you receive it at your end.
I've put mine up.
Right. Okay. I don't know what the problem is. Mine just goes in. I don't alter the volume at all.
Okay. All right then.
Just have a little play with your
No, my volume's
settings.
up.
Right. Okay.
Yeah.
I'll try to talk louder. I'm known for talking too loud. So, crossing the road, child gets knocked down. Mum immediately panics, runs into the road, gets knocked down. Take those few seconds to check you are safe, to check that traffic stopped, check that the electricity is undone. And this slide comes in here where infection may be around. Now, on some occasions, we can't avoid getting close to the person. They're not breathing, we need to push on the chest, etc. But if they've got an infection, they're not going to be coughing and spluttering anyway because they're not breathing. But quite often in first aid, you can keep a step back from them. And one of the examples is bleeding. Bleeding heavily. What do we need to do? If someone's bleeding heavily, what do we need to do?
Stop the bleeding.
Stop the bleeding. Some people don't always think it's obvious, but some people don't think of that straight away. Panic, what do I do? How do we stop the bleeding?
Pressure.
Where are we putting the pressure?
On the wound or where the bleeding is happening.
Directly on the wound, yes, absolutely. If somebody is bleeding excessively, pressure directly on the wound. Now, obviously, if they're very ill, you're going to have to get close to them and do it yourself. But talking of keeping your distance, you can tell them how to do it if they're still fit, still talking. Tell them to put pressure on the wound. They might already know, or they and forgotten in the panic, or they might not know at all. So you need to put pressure on that. Put some pressure on. Like this. Yep. No, just move it right over the wound. That's it. Now press really hard. Now hold it there. I'm going to call for help. You've kept your distance because they were coughing and sneezing, and they've got pressure on the wound. So they have actually started thinking, rather than panicking, they're now thinking they can help themselves. And you've changed the mindset a little bit, which is a good thing to avoid panic. So you don't always have to be right up to somebody to do first aid. And if somebody is coughing and spluttering, it is best to be safe. I know COVID's died down a little bit. It hasn't gone away. And what we all forgot about during COVID is that we always have flu around. And flu is a terrible illness if you get it. It's not just a cold. It's not a bit of a cold. I actually got flu 2 years ago off a person in a hospital and ended up in intensive care with flu. And I'd had my vaccine. So apparently if I hadn't, I wouldn't be here anymore. I just lay in intensive care saying, I've had my vaccine. I've had my vaccine. Like somebody was going to cure me.
Motion detected at the front.
Sorry about that. I'll unplug Alexa. She tends to join in my sessions. Right, she's unplugged. So that slide, as I say, was to remind you just that dangers aren't just cars, etc., that you may want to cover your face or their face. Still on the subject of danger. We're not talking what's wrong with him at the moment. We'll talk about that in a bit. At this point, would you feel you were able or safe enough to approach him?
Yeah.
I would say no, actually, only because I don't know whether he has like a weapon, for example. This is just me being cautious, maybe. I don't know whether he has a weapon. Maybe he might wake up suddenly and be scared that a stranger is approaching him at that point. So I would say no.
Yeah, I wouldn't approach him. I'll tell you now. Anybody else? Does anybody feel safe to approach him?
I would say yes, but then you approach him by actually saying something to him, etc., in a loud voice, because obviously he looks asleep or unconscious. Yes,
Yeah.
you drink, so there is a risk of how he will actually react, but leaving him to do nothing, except you have to make a decision to do something.
Yeah,
Absolutely. I'm with Darren, but once upon a time I would have been with you. But in December I'll be 70. Shh, don't tell anybody. I'm only 21. In December I'll be doddery and old. But seriously, because of what happened to me with the flu, I now can't go out teaching because I'm not very steady on my feet. I get wobbly and whatever. Once upon a time, I'd have been with you, James. I'd have been right up at the front. Are you all right, mate? Are you all right? A little bit caution to the wind. Now I would be approaching. In fact, what I would do, I would step back slightly and I would phone 999 and say, I'm not very steady on my feet. I'm a little bit nervous, but I can see this. And I'd be guided by them.
You got somebody in the background in a red jacket.
Yeah, that's us. That's me or you.
Oh, is it? Okay.
Yeah, that's me or you. I would step back round that building.
Okay.
And I would. And as Darren said, we don't know what he's carrying. For the first time ever last week, somebody said they wouldn't approach because he had a bag. And I was like, what? And I think they were talking about bombs. But that I'd never been in my head before. It's supposed to be his life belongings, I think, not a bomb. But I would now not approach, I would phone 999. So somewhere in between there, you will all be somewhere in there, not approaching or not. The one thing we don't want you to do is to walk away and do nothing. If you step back and phone 999, that's good. If you help him, even better. But do not take risks unless you're sure you can look after yourself. And some of the problems Darren mentioned, he looks as though he's asleep. He could just be having a sleep. But if he's like me, he'd be very grumpy if you wake him up. I'm awful in the morning. I might liven up by dinner time. But also, we've got alcohol there. He may have taken it, he may not. We don't judge. He may have sat where somebody else was drinking alcohol. But alcohol can make you aggressive. He may be diabetic. He may have fallen out of the tree and banged his head. Both of those can make you aggressive. So we need to be careful, or he may just be a horrible person. A scam can happen, but it's quite rare. It does happen, so don't dismiss it, but it is quite rare. You know, where he falls down to attract your attention. But then I would say in this occasion, it's a bit of a silly place to try a scam because there's no one else around. He doesn't know you're coming around the corner, so you'd be a bit lonely in this scam. Nevertheless, you have to think and make that decision yourself. And if your decision is, I'm backing off and phoning 999, that is fine. What we don't want you to do is walk away and do nothing. So the ones who thought they wouldn't go or said they wouldn't go, if I then tell you that on this side of the picture, there are lots of people. There's people sitting, having a picnic, walking the dog, whatever you might be doing in a cold park on a cold. I always imagine it's a Sunday morning for this one. I think that's because I go for walks on Sunday. So on a cold Sunday morning, there's lots of people here, and you come across this. Would that change your mind? Would that make you more brave enough to approach him cautiously?
Yeah, I think I'll agree with Martin then on that one, that I would go, or I would make my awareness known, because there's more people. So there's more people that may know actually what to do. So therefore you feel safer. But I'll still do the initial thing of calling the police, just making sure.
Yeah, absolutely. We have the choices there. This is assuming everybody has mobiles. But we've got all these people around. Now, I would change my mind. I would approach him. But I always, from my house, in a hallway, on a pavement, wherever I am, if there's an incident, I always shout for help because you might need help. So if I knew people were around, I'd approach him, but I'd be saying, does anybody know this man? Is he with anybody? Did anybody see what happened? How long's he been lying here? I need some help here. How many do you think could come running forward?
I think barely any if there's people around watching and they're not doing anything. I'd feel safer knowing that there are people there, but I wouldn't trust them to have my back if something were to happen.
Yeah, that's my theory, really. Not many would help you. They might all put you on TikTok and make you famous, but they wouldn't help you. Some would. But my theory is at least then if he does become aggressive, other people know I'm there. So that would make a difference for me.
I found if you approach somebody who's collapsed, etc., everybody's looking until the first person steps in. Then other people will approach and to help.
Yes. Yeah. If you start the help, quite often people will step in, but never everybody, or rarely everybody. Have you stepped in for people before then?
Yeah, years ago, an old man collapsed, and no word to lie, I must have walked 15 meters, and people were just passing him by. And then when you get down to actually check on him, all of a sudden you're surrounded by people, and people are coming out of shops, etc., offering help.
Yeah, it needs somebody to take that first step.
Yeah.
It's called the bystander effect. And it happens in other walks of life, but certainly in first aid, it describes a situation where people see somebody in need of help, but no one steps forward. This could apply to the washing up on Christmas Day in my house. I can tell you exactly who will start it, and I can tell you it won't be straight away, and I can tell you when it starts, others will help, but never everybody. So I always think of Christmas Day when I'm talking about this. The bystander effect describes a situation where people see someone in need of help, but no one steps forward. But we do know that once people understand this effect, they are more likely to help someone in need of first aid. That sentence is a little bit convoluted. What we're saying is if someone steps forward, others will. Not many, but others will. I'll explain it in this video, or this video will explain it for you. It's a scenario we created based on lots of research. And if you will hear voices, and it's the voices inside people's head, their response as the man becomes unwell. You will also hear his voice in a voice because he's scared.
Oh, this song is so good. Can't wait to see them live. I wonder if I should move my bag so someone can sit down. Nah, that guy's got his bag on the seat. It doesn't matter. Did that guy just collapse? Is he okay? Is anyone gonna do anything? Okay, that's weird. No one's doing anything. Maybe he's okay. Should I check on him? I don't know.
What's the matter with this guy? Is he drunk already? Blimey, from last night? This morning? Well, each to their own, I suppose. Although, actually, maybe he's diabetic or something. Nah, he's probably just drunk. Oh, it looks like he's moved a bit. Maybe he's having a nap. Yeah, he's probably just sleeping it off. Look, he's okay. He's just had one too many. I mean, no one else seems worried. Yeah, I'm sure. He's fine.
I really don't think he's okay. Maybe he needs help. Should I get help? I wonder if anyone's going to do anything. He really doesn't look right. Is he awake? Is he passed out? Is he having a heart attack? Maybe he's fainted. But even if he's fainted, should I help? It's been years since I've done any first aid. What do I do first? I can't even remember. Do I need to move him? It looks pretty heavy. I'd need help. Oh, this is horrible. No one's doing anything. Maybe he's all right. I don't know what to do.
What's happening to me? I feel terrible. I need help. Why won't somebody help me?
Hello? Can you hear me? Hello?
Is he breathing?
I think so. Yes. Yes, he is.
Is he okay?
I've called 999. An ambulance is going to meet us at the station.
Right, I'm gonna go find the conductor.
We need to roll him onto his side. Can you help me?
Yeah, of course. Tell me what to do.
Don't worry. We're here.
Don't worry, we're here. I'm trying to stop it. It wants to play again. There we are. Don't worry, we're here. So that was the start of first aid. Don't worry, we're here. He was panicking. He's scared. He doesn't know what's wrong with him. And somebody is now there.
Can I just make a comment?
Yeah.
When I used to volunteer on a lifeboat years ago, and we were always taught, don't judge the person who's possibly injured, etc. Imagine it's a member of your family. So I always imagine it's my daughter. If it was my daughter, you would go straight. You wouldn't be judging what the person is. Yes, you would do the risk assessment, but you wouldn't be actually judging the person.
Yeah, that's really a good thing. Where were you on the lifeboat?
Down on the Solent.
Oh, right.
It was an independent lifeboat, so I used to do weekends and during Cowes Week, etc. So it used to be fun.
One of my colleagues used to be on the lifeboats in Blackpool.
Okay.
Not quite as nice water, but he used to, and he knows lots of first aid that we wouldn't normally be teaching here because of the need to be quick and urgent in the water. Excuse me. So the lady stepped forward. Do you remember what was putting her off stepping forward? What did she said, it's years since I've done any first aid. So you panic, you've forgotten. So, but we do know that if you start trying to help, things will come back to you as it did to her. It started off with the young lady in the corner doing what we all subconsciously do. Should I move my bag? Oh, everybody else has got theirs on the seat. It's all right. And she did exactly the same when she noticed a man becoming unwell. Shall I go and help him? No, nobody's helping. He must be all right. And it's a subconscious thing. We're like sheep, really, watching each other. No, it's fine. People do that. As I say, the lady who eventually did help, she was panicking. She hadn't done it for years. Some people get scared because their certificate has run out. If they've done a full 3-day course and then the certificate runs out. Now, for the purposes of insurance, work or schools or wherever, you may need a certificate. But not having that certificate, not having the certificate expire doesn't mean that it wipes the in knowledge out of your head. You can still do first aid in the street. You've got the knowledge there. And then there was the man in the corner who you may have been referring to, James. He was a little judgmental. What, drunk at this time of the morning? He wasn't quite rude, but he did say it. Although when the lady stepped forward, he was one of the ones who jumped up to help, as was the young lady with the bag. She went to get the guard. But he did mention this alcohol. Now, when I talk about alcohol, I'm talking about drugs or alcohol. We don't judge. We don't judge, as James said. We don't know how he's arrived drunk on a train. He may be a teetotaler. He may have been having his coffee in the cafe and somebody spiked his drink, and it happens, I'm afraid. It does happen. It's not totally, I was going to say it's not common, but it is, because I know 2 people who've been spiked, 2 males. Now, they were not assaulted afterwards because they were in groups of males, but on separate occasions, my grandson and his mates went out and one of his mates was spiked, and then a few weeks later he was spiked. Both ended up in hospital because don't know what they put in the drink, but they didn't appear to have been assaulted or robbed or anything. Just maybe it was fun to spike somebody's drink. I don't know. So this poor man could be a totally innocent person and does not know what's happening to him because now he's going unconscious through drink or drugs. So we don't judge. We don't judge if he's the world's worst alcoholic. Alcoholism is an illness, and he can't help it at this point. Eventually he can get help, but at this point he's at the stage he hasn't got help. So we should not be making that judgment. What we see is somebody who needs help. If you've taken alcohol or drugs to the point you're unsteady and falling over, yes, I know it happens. I know every Friday night the towns are full of people, but truthfully, they are becoming unwell. They're on the road to passing out from alcohol. And if you do pass out, you are ill. It's not a bit of fun. It's not, oh, they won, they drunk the most. It's they're ill. So we should get help. Normally, you would give them some water, sitting up, give them some water, get them to sleep on the side so they're not sick. But obviously, if you can't rouse them, you need an ambulance. So he decided he might be drunk or drugs. He also said something else that's concerning. He said he might be diabetic. Now, does anybody know about diabetes? Anybody know anybody with diabetes?
I know what it is, but I wouldn't be able to explain signs or symptoms of someone who's having a negative effect.
Okay. Well, you know, if somebody has got diabetes now, because I've got diabetes too. I've got my bracelet there. So if I collapse on the train, you will see it says diabetes 2, because I'm very efficient. I've also at the moment got, I don't think you can see it under my little fat arm. I've got a monitor. You might see them on the back of their arms. They look like HRT patches or something. But it's a monitor. It's monitoring my glucose every minute, literally. It goes to my phone. Then it starts pinging that it's too low, and I find it's the monitor that's faulty, not me. But anyway, so you could see signs that he's a diabetic. And diabetes is a horrible disease. It does all sorts to you. But the main thing we know is they can't have sugar. I can't have sugar or shouldn't have sugar. But what we also know is if your blood sugar drops too low, and there could be lots of reasons, he could have skipped his breakfast, he could have got all his medicines balanced, but then he ran for the train and he just went out a little bit and he started to pass out. And it's horrible. It can be leading to diabetic coma, and you may have heard of that and how horrible it is. But in actual fact, it's one of the easiest things to treat, to do something about. All you have to do is give him some sugar, the very thing he's not allowed. So he's, for whatever reason, his glucose has dropped far too low. He starts to become maybe a little bit aggressive, certainly appearing drunk, wobbly, till eventually he passes out. Bit of sugar. A drink of cola with sugar in it, the thing you can't have normally. Little sweets, Skittles, anything you've got. He may carry glucose tablets. He's supposed to, I don't. He's supposed to carry glucose tablets. So he might say, in my pocket, there's some glucose tablets. Give him some sugar and he will start to recover very quickly, and you won't even need an ambulance, because when he gets his wobbliness back, when he settles, he knows what he needs. He knows he needs to go and get a sandwich or something like that. It's really easy to treat, but it's also something that will go really bad if you don't treat it. So we're not looking for ambulances or anything, just give him a little bit of sugar. If for some reason it's not diabetes, maybe something else is happening to him, and you give him this sugar, you're not going to make his diabetes worse. Obviously, we then need to find out what is wrong with him, but that bit of sugar will not have had a negative effect on him. But leaving him without could do. So if somebody is diabetic, they might be wearing whatever, necklace, whatever, just give them some sugar. And it should, within a few minutes, they should start to level off. I can't think of anything else that was said on there. But I think the main purpose is to say we shouldn't be judgmental, we should help. And when we help, someone else will step forward. So let's talk about unresponsive and breathing, which we're hoping the man under the tree was breathing, and this man on the train was breathing. But he became unresponsive. How do we know he became unresponsive?
Because he's not responding. If you're talking to him or just moving him slightly, he's not responding to the external
Exactly. Again, we're not medics, we're not doctors, we're not looking for medical reactions. Hello, mate, you all right? No response. As you say, you might shake his shoulders gently. Are you all right? You might be braver and pinch his hand or pinch his ear gently. Everybody's going to say, get off. He doesn't say get off. He's unresponsive. We know we need help. Now, unresponsive and breathing, how do we know he's breathing?
You can check his nose and ears with your cheek next to it, seeing if the chest is raising or falling.
Yeah, we're looking, feeling and listening for breaths. Normally you can tell without doing anything special, really. You'll see his chest moving or whatever. We're looking for breaths. Because when you phone 999, they'll ask you what's your emergency, fire, police, ambulance, Coast Guard, or mountain rescue we can get now. But they're looking for guidance. What's your emergency? Oh, there's a man here. He's not very well. Right, they'll put you through to the ambulance. Do you know what the first question you'll get there?
Is he breathing?
Is the casualty breathing? That'll be the first question to find out. Is he breathing? Now, as I said, we've already looked, we can tell he's breathing. Yes, he's breathing. But sometimes people can fall awkwardly. So they're not dying. They're not desperately ill in terms of what's wrong with them. But as they fall, they block their own breathing. I saved a life once. And that is exactly what happened. I made the judgment it was safe. I was slightly wrong because he was in front of an open shop, but the woman inside told me in no uncertain terms she wasn't helping him. He'd been shoplifting and he was very drunk. But I pushed him on his back to see if he was breathing, and he wasn't. And then I remembered, because I used to forget the bit I'm going to tell you now, tilting the head back, hand on the forehead, push the chin back. After that day, I'll never forget it because I did that. Pushed his head back and he made an awful noise, really awful, snorty noise, and started breathing. He was drunk, shoplifting, he'd run out of the shop, he'd tripped over and he'd fallen and he'd actually blocked his own, knocked himself out and blocked his own airway. He wasn't breathing. If I hadn't stopped, there was no one else around, he would have died because he tripped up. So always, if you cannot see evidence of breathing, always do this. So we've now decided we've got a casualty who is unresponsive and breathing. We phone 999, we reassure them, and we put them on their side. Because if you leave him on his back, he might start to vomit and he will quietly drown and you won't even know it's happening because it doesn't make a noise. Put him on his side and it all flows out at the side if he's sick. That's a lovely picture, but that's the fact. Once he's on his side, make sure his head's back again because the head will tilt forward. I'll show you how to do it.
Can you share your screen, Judith? We're seeing you, not what you're.
I am so sorry.
Okay.
I stopped. Hang on, let me stop the video. I stopped sharing to talk to you and I lost you half an hour ago, I think. Right. Thank you. Natalie will now show you. Can you see her now?
Unresponsive and breathing. If someone is unresponsive, gently shake their shoulders. Check for breathing by tilting their head back. Is their chest moving? Look, listen and feel for breaths. If they are breathing, move them onto their side and tilt their head back. Call 999. Here's a recap.
So head back, and once you've pulled him on his side, put his head back again. Unresponsive and breathing.
Judith.
Any questions on that?
Judith, I just wanted to ask, if suppose, it may sound like a silly question, but suppose he's not breathing, would you still proceed to the second step of moving him to the side, or would you leave the person there?
No, you leave him on his back, and I'm going to tell you exactly what you need to do. Don't push him on his side. On his side, there's an assumption he's safe, he's breathing, and you just put him on his side to let any body fluids flow out. It's never a pretty thing when they're not well. Okay, unresponsive and breathing, move them on the siding, tilt their head back, call 999 and reassure them. So there's your question now, Darren. I'm starting to wonder what to do when you've got a frog in your throat. Unresponsive and breathing. We need to push on the chest.
Okay.
Quickly. We need to phone 999. Quickly. Are you all right, Danielle? Have you got your hand up or are you thinking? You're just thinking. Okay. You need to push on the chest. Unresponsive and not breathing. If someone is not breathing, if you don't push on the chest, they will die. These are very rough figures based on their health and age and everything, but roughly 3 minutes and you have brain damage beginning, and by 8 minutes it's brain death. So when the ambulance arrives, they have nothing to work with. You need to oxygenate all their organs by pushing on their chest hard and fast. So you've found them, you've checked that they're breathing by tilting their head back, they're not breathing. We're going to phone 999 and we're going to give chest compressions. Now, if you remember, I said earlier on, I always shout for help, even if I can't see anybody. I need some help in here, because it's better if you've got other people around. But if you really haven't, you actually need, although I've just told you how important it is to push on the chest, how urgent it is, you need to phone 999 first, because pushing on the chest, unfortunately, doesn't make them breathe. In rare circumstances, drowning being one of them, it could make them breathe, or choking, it could make them breathe, but more often than not, it doesn't. So is there any point in doing it? Yes, because we're oxygenating their body. We're keeping the oxygen flowing. We're keeping the organs alive until somebody can come along and get them to breathe again. So you give chest compressions. And I'm not going to make it pretty. It's hard to do. Adrenaline will help you. And I'll show you a little tip of how to make it a bit easier. Adrenaline will help you. Hopefully you've got somebody else who can take over and then swap back. But unless you've got equipment or drugs, they are unlikely to start breathing. If they do, you put them on the side and their head back. But mostly they won't. You're going to be doing this till the ambulance gets there. So you keep pushing. And it looks horrible. They're a funny colour. They're not responding in any way. You're pushing hard on the chest and they're just wobbling around. You just keep going. Don't think after a few minutes it's not working. You're not going to see anything working, but it is working. That's the really important part, not to give up because it looks as though it's not working. If you're pushing hard and fast on their chest, it is working. To push on the chest, to make it easier on yourself, use the heel of your hand right into the middle of the chest, right across from the armpits to the middle of the chest. Use your hand. Put the other hand on top. And this is the bit that will make it easier, is straighten your elbows. We're not pushing with our arms because you will start to feel pain down your neck and your arms. You're keeping your arms straight. The movement is coming from your hips. You're kneeling at the side of him and you're pushing into him with your body weight. This is for adults. It's different for babies and children, and I'll tell you how to find out more about that later. Into the chest as hard as you can. You're trying to push this chest roughly 2 inches, 5 centimeters in. It's a long way. You cannot practice this on a breathing person. Keep pushing hard and fast. 1, 2, 3, 4. 1, 2, 3, 4. And obviously phoning the ambulance. So hopefully somebody else is doing that, or you've already done it.
Unresponsive and not breathing. If someone is unresponsive, check if they are breathing. Tilt their head back. Is their chest moving? Look, listen and feel for breaths. If they are not breathing, call 999. Give chest compressions by pushing firmly in the middle of their chest, up and down. Push the chest hard and fast at a regular rate of 2 pushes per second. Continue to push in this way until help arrives.
The paramedics are here.
Here's a recap.
The paramedics are here. You carry on. They will come in, unpack their equipment quickly and take over from you. Don't stop and leave them in a panic of what they need to do. Let them get the stuff sorted out. Paramedics are here. Oh, excuse me. Hard and fast on the chest. Any questions so far? Okay. Don't be scared of doing this, and don't be scared of the pressure. And try to keep going. Remember, I did say your safety was paramount. So if you start to become unwell, you have to stop. But unfortunately, if you do stop, you're also stopping the help they need. But nevertheless, you must make wise decisions for yourself as well. So we're pushing and pushing and pushing until help arrives. And these days, the help might not be an ambulance, or it will be eventually, but you might end up with an AED in your hand. Do you know what one of those is? Anybody who's off camera, do you know? Sorry, go on.
Something defibrillator.
Something. That's why we call it
electronic defibrillator.
External. That's why we call it defib, because it is something defibrillator. It's automated external defibrillator, but the person might have died by the time you said all that. So defib, automated external defibrillator, AED, defib. And can you end up with one in your hands? Yes, you can. They are in all sorts of places now. Just down the corner from me, there's a farm. It's just a farm, and it has an ice cream shop. That's all it is. It's not a cafe. It's just an ice cream shop, little kiosk. Go there a lot. And they have a defibrillator on the wall. It was put there by British Heart Foundation. You can access it 24 hours a day. They're in supermarkets, libraries, public buildings, churches, mosques. Lots of people have them. And when you phone 999 and you tell them where you are, they are likely to say to you, go to the lamppost just round the corner and you'll find a defibrillator, get it. Now, you don't go for it, or rather, one person goes for it, one person pushes on the chest. It doesn't matter which one. What is important is you don't leave the patient. If there's only you don't go for the defibrillator, unless it's in the next room, obviously. But you don't go wandering off, leaving the patient. We need you to be pushing. Now, out of interest, or for your interest, I've put in the chat Defib Finder UK. You put your postcode in, it tells you where your local defibs are. That's just for information, because you will need to find a code for them. I was quite surprised how many are near me when I put, and I always think of the farm, but closer to me, you have to pass it to get to the farm, is the doctor's surgery and the school. Obviously, they're closed sometimes, but they have defibrillators. So I've got quite a few around me, but you need someone to go for it. You don't leave the casualty. So, do you all know what a defibrillator is? What it does?
Sends an electric shock into the body.
It gives a shock. It's right through the heart.
Oh.
Bit scary. Are you qualified to do that? Yes, you are. Because you are not making the decision. This machine is your decision, and it should always be your decision, is to put attach the defibrillator, and that's where your decision making ends. It's attached by sticky pads, and I'm low today. Sometimes I'm right up there, my chair moves, but if you can see here, I'm touching my right shoulder. The one part of the defibrillator, one pad, goes on your chest near your right shoulder. The other one, if you imagine an arc going through your heart, so just under your left arm, over the left rib, there's pictures on the defibrillator, and I'm going to show you how to use it in a minute. And you put the other pad there. Once they're in place, the defibrillator is making the decisions. It is so clever. Still need you to push on the chest. It's not for lazy people. We still need the pushing on the chest, but the defibrillator knows exactly what is needed. Sometimes people do not need a shock. That's a minor amount of people. So if it doesn't shock, don't think it's not working. It knows what's needed. Most people do need a shock. And it gives instructions according to what it's finding. So again, I can give you roughly what it will say. It will say, make sure help has been called, attach the pads. Then it'll tell you to push on the, well, you should be pushing on the chest anyway. Somebody else attaches the pads around you. You're pushing on the chest. Then it will say, analysing, stand clear. You need to take your hands off the patient. Just lift your hands. You don't need to get up. Just lift your hands. Because if you leave your hands on the patient, it finds your heartbeat and it thinks everything's great. So don't touch the patient when it tells you not to. Make sure no one else is touching the patient. And then it'll analyse it. You won't hear anything. It's doing whatever it needs to do. Then it makes a decision. And it may decide you need to carry on with compressions, or it may decide shock required. And it will tell you again, do not touch the patient. Shock required. Do not touch the patient. Now, I'm being told that the more modern ones now ask you to push a button again. Nobody quite knows why, because you can push that button all day long and it will not deliver a shock if one isn't required. Nevertheless, they are now starting to ask you to push a button. Push the button. You're not making a decision. You're not in charge. It's just, think of it as, yeah, I've heard you. We've let go of the patient. Push the button. It might not ask for the button, but you must take your hands off the patient. It will then deliver a shock. The person will wobble a bit, nothing dramatic, and then it'll go quiet because it's analysing. Now, if you're lucky, the patient will start breathing. And what do we do with this patient who is breathing?
Put them on their side and tilt their head.
Brilliant. Put them on the side and put the head back. Keep watching them, keep the pads on, because they might stop breathing again, in which case you're going back on the back, pushing on the chest, the defib takes over. However, it might need many shocks. Do not be surprised if it shocks, push on the chest, shocks, and so on and so forth, till the ambulance gets there. They might need drugs as well. So this defib has come along, and you're going to follow the voice prompts. Now I'm going to put all we've said together here, and I'm going to show you this video.
It was a normal day for me. I was head chef at a hotel at the time. I'd gone in as I would every other Sunday. So I just went around kind of doing my daily tasks, getting ready for the week ahead. We had a girl kind of come into the kitchen and say, oh, someone's fainted outside. I'd only just finished my first aid training the week before, so I thought, I'll go and see what I can do to help if I can in any way. I found Ben on the floor, and I suppose it was at that moment I realised it wasn't just a faint. It was serious. There was no colour on him. So my first instinct was to pull out my phone, dial 999. I'll never forget having to answer that first question, is the patient breathing? And then this is what happened next. We had to check, was he breathing? You know, we looked to see if his chest was rising at all, to listen to see if he was breathing. And it was obviously at that moment we had to say no, he's not breathing. We started chest compressions to try and get blood flowing around the body to get oxygen to the parts that need it the most. My phone was on speaker and the operator did assist in saying, Have you got an AED defibrillator on site? Fortunately, one of my colleagues was there with me as well. We got the AED defibrillator on site next to us. I can kind of remember peeling back the packet to open it up. It was literally one pad goes there, one pad goes there.
Peel second pad and place on bare lower chest as shown.
After switching the machine on, it does its initial assessment and straight away a shock was advised. And we delivered the shock.
It is now safe to touch the patient.
It directed us to start chest compressions again, and this metronome starts to kick in to help you count with your compressions. It tells you if you're not pushing fast enough, if you're not pushing hard enough, so it keeps you focused. It did its second assessment, and the second shock was advised.
Charging. Stand clear. Push flashing button to deliver shock. It is now safe to touch the patient.
We continued to do chest compressions. I'll be honest, the minutes felt like hours. The metronome was still going. The sense of relief to look up and to see the paramedics come through the door. I thought, well, we've really done all we can.
If someone is unresponsive, check if they are breathing. Tilt their head back. Is their chest moving? Look, listen, and feel for breaths. If they are not breathing, call 999. Tell someone to get an AED as soon as possible. Give chest compressions by pushing firmly in the middle of their chest up and down. Push the chest hard and fast at a regular rate of 2 pushes per second. When the AED arrives, open it and follow the voice prompts.
At the time of my cardiac arrest, I was 17 years old, working as a waiter inside a restaurant. Before the cardiac arrest happened, me and Josh barely knew each other. Now, me and Josh have become the closest of friends with a very unique bond that can only be made through the help of someone saving your life.
So with an AED defibrillator, I'll be honest, the instructions are that easy to follow. You can't do anything wrong in trying to get it on, and you getting it on and switching it on is going to give someone the potential to save their life.
Quite thought-provoking. So just take a deep breath. It's something I hope you're never involved in, but it does need your rapid action if you are. Any questions on that? Or comments? Okay, now I'm going to try something. I'm supposed to put you into... Miriam may have got the wrong time. Hello, Miriam.
Hello, sorry I'm late.
Oh, right, okay. I was just wondering if you got the wrong time. We are just going into breakout rooms to discuss something. I'm going to try this. It might not work and we might all end up back here. I'm supposed to put you in breakout rooms and quite often it doesn't work. I will try. What I want you to do, you'll be in 2 rooms, and I want room 1 to talk about heart attacks, signs, symptoms, and what you might do. And I want room 2 to talk about strokes. Same thing. So I'm going to create 2 rooms, and I'm going to press now. I will call you back in 2 minutes. Oh, I told them it wouldn't work. No, I am not going to spend my time doing this. We used to teach on Zoom, and it's so easy to use the breakout rooms, but unless you have a Redcross email address, they're very complicated, the breakout rooms, and I'm not going to do it. We will sit here and discuss heart attacks and stroke. I'm sorry that means more of me talking, but blame Microsoft Teams, not me. So heart attack, how do we know if someone's having a heart attack?
Side of left face, one side of their face will droop. Slurred speech.
That's, you're going on to stroke there, James.
Okay.
I think. You can tell us that in a minute. Heart attack.
Usually they'll grip their heart area, as the picture will show. Usually it's quite painful, so they usually I want to say gasping for air. They're usually gasping, but you can tell that they're in oh gosh, what's the word? In a lot of pain. Yeah, they're in a lot of pain.
Excruciating.
Excruciating, that's the word, sorry.
You can't say it if you're having a heart attack.
Yeah. But essentially, even that one alone, like, they can't really speak either. So you can just tell there's a sudden pain, basically.
Yeah. It is very painful, usually.
Yeah.
I say
breaking
usually.
out like cold sweats and dizziness as well.
Yeah, absolutely. They will be sweating a lot. They'll be feeling dizzy. They'll say they feel ill, or they might not be able to say they feel ill. They might be able to not talk, I should say. Any other symptoms? What about the skin?
Their arms might hurt.
Which arm? I'm going to put you on the spot now. Which arm?
Left one?
Left one. Yeah, it's all left side. Central to left-sided. So it'd be the left arm. You might get pins and needles down your arm. Into your jaw or over your shoulder. You don't get all these symptoms, or you might do. And it is usually, no doubt, there's a heart attack going on. It's absolutely excruciating pain. But sometimes it's not, and that's where the complication starts. Sometimes they're mild, the same things, oh, feel a bit uncomfortable. My arm feels funny. Or it may be the jaw. Women apparently don't usually feel pain as badly as men. This particular pain as badly as men. It's not set in stone. It can be the other way around. Women can get the excruciating pain, but quite often women don't get the pain as badly. There you are. Sarah, do you want to tell us about that, please? Or have you not got
it's just what you were saying, that you don't necessarily get pain with a heart attack, but it's a bit of a saga. My mum is okay now, but it wasn't diagnosed for a number of weeks, and it all escalated into a bit of a crisis. But it's because it wasn't recognised as being a heart attack by the GP, and then anyway, there was no pain, so she was quite breathless. I wasn't with her. She was in Spain, and she didn't realise what was going on. So she flew back to the UK and then drove home to Wales. And then had 2 months of saying, can't breathe well. And the GP kept sending her away. And then, anyway.
Unfortunately, it can happen like that. And it's a bit frightening. I assume, like you said, breathlessness. She had lots of sort of symptoms, but not what you would expect.
Yeah, no chest pain, but of course, something was wrong. But the GP kept saying, it must be a panic attack from the sounds of it. Anyway.
They can make mistakes, I'm afraid. Last year, they told my daughter she had COVID and she'd sprained her leg because she had pain in her leg, and she actually had a ruptured appendix and sepsis.
Oh.
So they can. I mean, the doctors, but they're sitting in a surgery with really not much equipment around. It's not great for them. But absolutely, you can have. I know somebody else, a man who had no pain at all. He just didn't feel right, and because he taught first aid, he went off to the doctor and said something's not right, and it was a heart attack. However, they're quite unusual, so don't panic. You're having a heart attack at this moment. I've had indigestion sometimes. I thought, whoa, what's going on? But usually we've got this gripping in your chest, you can see. And even if it's not very bad pain, the response has to be equally urgent, because it could be a major heart attack with little pain, or it could be leading up to a major heart attack. My dad, many years ago, before, 50 odd years ago, before defibs and everything, he had a mild heart attack. And in those days, you phoned the GP. GP came round and said, I think it's a heart attack, but it's mild, don't worry. Phoned the ambulance, and before the ambulance got there, he'd had another heart attack and died. So even if the symptoms are very mild, you phone 999 and you say, I think it's a heart attack. And you reassure them. It's so important. It's not just being nice. It's not just the Red Cross way. It really helps if you're talking gently. Don't lie. Don't say, oh, of course it's not a heart attack. You'll be fine. Don't lie to them, but just say, don't worry. Help's on its way. I'm sitting with you. They're not far away now, etc., etc. Just be calm and comforting. Reassure them. And if they've had a previous heart attack, they may have a spray that they spray into the mouth. Encourage them to take it. People don't like taking it because it gives a headache. Encourage them to take it. You can't just put it in the mouth and spray. They have to cooperate, move the tongue, but encourage them to take it. But be calm. Afterwards, you can panic. You can talk to friends. You can talk to, even if you're really upset, you can talk to the Samaritans and say, look, this happened today. I'm really upset. And they will talk to you. But at the time, you're super calm, because they need you to be calm. And you sit them comfortably. And there's the sitting comfortably at a la Red Cross. What we're saying is don't want them on the chair like you're probably sitting on now. I'm sitting on a computer chair. If I started getting chest pain, you would see me sink to the floor, because you don't want them falling off the chair, breaking their arms. And the back of the legs are compressed. All of us are sitting here now, and it's not a problem. We've got a little bit of pushing on the back of our legs. That's fine. But if your circulatory system is compromised, you must take as much pressure off as you can. So sit them on the bum, but the legs off the floor. So the knees off the floor, I should say. Don't have them waving their legs up in the air. So exactly that position. He's leaning against a wall. He could be leaning against you if you're in a field. He doesn't have to be sitting upright, but he does have to be comfortable and able to relax. Seat them comfortably.
Heart attack. If you suspect that someone is having a heart attack, call 999.
Hello? Ambulance, please.
Help the person to sit down. Ensure they are comfortable, for example, sitting on the floor and leaning against a chair or a wall. Reassure them while you wait for an ambulance. Here's a recap.
Sit them comfortably until an ambulance arrives. Any questions on heart attack? It is an urgent call, even if they don't seem to be too unwell. If you're suspecting heart attack, it's a 999 call. So we'll move on to stroke then, because people often lump the two together or even mix them up. So who's going to tell? James, it was you, wasn't it, going to tell me about a stroke?
Yeah, it's only really from the TV adverts where somebody's face is drooping, slurred speech is what I can remember.
Absolutely. That's where we get most of our information, isn't it? Either adverts or Casualty. it's one of them. Although Casualty comes up with some very weird things at times and unusual things. So I don't watch it anymore. I stopped watching when Charlie left, to those of you who watch. Yes, stroke.
Is the acronym still FAST?
It is.
Or has it changed?
We haven't changed it because we want you to act fast. But it really is as urgent as a heart attack. People think because they're not rolling in pain and whatever, it's not as urgent. You can wash the pots and walk the dog. You can't. You must phone equally fast. Do you know what the acronym stands for?
Face, possibly arms, speech or smile, and talk. It's either one or the other.
Yeah. We say time for the T, but it's the same thing. We want to know all those things you're talking about. But we say time to phone an ambulance now. Very dramatic. And it is. Has their face drooped on one side? Now, we talked about a heart attack, it's left-sided. A stroke can be either side. It can be left side or right side, but what it is one-sided. So the face might droop. The arms, ask them to just hold, don't be dramatic, just ask them to say, can you hold my hand? And they might not be able to lift one hand up. And they might lift the hand up, but you find one's really weak. Speech, can they talk? Can they smile? Because the face is drooping. And T, as Shahina said, time to call 999, or we say time to call, that's what we do say, time to call 999, or you could think about talking. Time to call 999, it really is important you are equally quickly phoning for help, because the quicker they get the drug, the more they will recover. Sometimes people are left disabled, but this drug reduces the amount of disability and some people recover fully. So get them to hospital as soon as you can. What age are we talking about?
Any age, isn't it?
It is, absolutely. We tend to think of older people because as we get older, things happen, things start to fall apart. I can tell you that, things fall apart. But any age, even a baby. Remember that, even a baby. It is incredibly rare. But if you see these signs in a baby, you phone up and you say you think it's a stroke. Teenagers is becoming a little bit more common. Those of you who watch soaps, I was educated on this one, but you might know now there's a reason a lot of teenagers are having strokes. But they can have them for other reasons as well. And anybody, 20s, 30s, obviously it increases as you get older. But strokes are now more common amongst teenagers, and they can happen to babies. Call 999, help them to sit down, talk to the person to reassure them while you wait for an ambulance. Here we are again with the reassure, keep them calm. If they ask if it's a stroke, this is how you handle them probably. It's up to you. But I would say, well, it's looking like a stroke, but we've got an ambulance on the way, don't worry, etc. I would never lie and say, no, it's not a stroke. Of course it's not. But I would try and play it down a little bit. So for a stroke, you call 999 and you act fast. Face, arms, speech, time. Any questions on that? Okay. So here's my first aid kit. I don't have a first aid kit. I have to admit, they go out of date. Even bandages have a date on them these days for some reason. So I don't have one. I have one in my car, a mini one, but in my house, these are the things you could use. We've got the sweets I mentioned earlier on for diabetes. Now, head injury. If you bang your head, in fact, it's not just head injury. If you twist your arm, twist your ankle, if you know it's not a break, you're certain it's not a break, you need to keep it cool. Anything that swells when you bang it, it hurts. If you reduce the swelling, it reduces the pain. So you can use something from the freezer. We talk about peas, not because they have a magic quality, but because you can bend them a bit more around the. But if you're just standing up with a big chicken stuck on your head, at least it's something cool. Something cool. And we've put the tea towels above it because if you put something cold on your skin, frozen, you could get a burn, strangely enough. You might have heard of freezer burn or cold burn. Something too cold on your skin can burn your skin. Be careful with the snowballs and making the snowmen. A freezer burn. And you can have friction burns. Sunburn. We use that word sunburn, but we don't treat it as a burn. We should. Sunburn, friction burn, freezer burn, or a burn. And they're all treated the same way. Do you know how to treat them? What do you do with a burn?
Aren't you meant to run it under cold water for 20 to 30 minutes?
Brilliant. Oh, you're even worse now. It used to be 10 minutes. Now it's 20, but you've just made it 30. It's so boring standing there with your finger under the tap. And I didn't do it 2 Christmases ago. I burnt just the end of my finger, just, oh, I'm busy making me dinner. And I suffered till the middle of March. Right inside, it didn't break the skin, but right inside I could see a white thing. And the pain was horrible because I didn't run it under cold running water. Now, obviously, a bigger burn, it would be more serious. You must put it under cold running water. What it does is help to take away the pain. It can even stop the burn altogether if you're quick enough. Many years ago, I didn't know first aid, but many years ago, my son jumped into a cup of tea, he was only little, and knocked it all over him. And there was some cold water in a jug, and I just went like that. But he didn't get any marks on him or anything. It can, if you're quick enough, stop any problem at all. But even if it started breaking the skin and burning, etc., you must cold water for 20 minutes. If it's a massive burn, you're putting them in the shower and gently running the shower. Don't spray them because it will start breaking the skin, but cold running water. Do you take the clothes off?
Yes.
Yes, but you don't want them to stick to you.
Right. You both said yes, right? You take top layers off if you can. It's not the prime thing you do, but so if they've got a cardigan or something, but if it's near the skin, don't take it off because it is sticking to the skin. And when my other son, I'm a great mother, when my other son was scalded, somebody dropped coffee right into his shoe. I didn't know any first aid. I took his shoe off and then I took his sock off and I took his skin off. Top layer of skin, perfect sock shape, came off. We were on a train and there was no running water. And it was all panic. Nobody knew it's 35 years ago. Nobody knew what to do. All panic. And they called an ambulance and it was horrible. And I was sort of holding him, leaning against a fridge in the buffet car. And in the fridge was water and wine and beer and lemonade and cola. All nicely cooled in the fridge. Any one of those could have been put on him and cooled him. I'd already taken the skin off, but it still would have helped. Instead, they diverted the train, and when the train arrived, he had blisters underneath blisters. It had just gone so deep. He was in hospital 4 days, all from a little tiny ankle. He's fortunate it didn't touch the ligaments and he's now recovered 30 odd years ago. Emotionally, he hasn't. He uses it to blackmail me. Make my tea. No, I've got a scar because of you. All right. But water, anything that is cool can go on this burn. The whole point of it is to cool it. Once it's cool for 20 minutes, you can cover it in cling film, not tightly, loosely in cling film. like a balloon around it, to keep the infection out. And then what you do with it afterwards is your choice. It may be a minor burn, and you have things that you use. If it's a little bit more, but maybe contact the pharmacist, your GP, or obviously, if it's quite bad, phone 999. And the phone, what's the phone for? I'm going to recap everything, and then I'm going to tell you what the phone is for. Unresponsive and breathing, what do you do? I'm going to pick on people now. Harry, Omar, Camille, Eleanor, Miriam. Unresponsive and breathing, what do we do?
Recovery position?
Until the head back.
Until the head back. Brilliant. Well remembered. Tilt the head back. Unresponsive and not breathing.
Tilt the head back and start chest compressions.
Give chest compressions, yes. Unresponsive and not breathing with a defib.
Follow the instructions.
Brilliant. Open the device and follow the voice prompts. Do not be afraid to use this machine. It's magic. Heart attack. What do we do? I've told you.
Get them to sit down and call for help.
Yes, sit down. Remember, they're sitting down comfortably. If they're in bed, lying down, raise them up slightly. Don't worry about the legs in bed, but raise them up just so the pillows are lifting the head above the chest. Stroke.
Check for face and call 999.
Brilliant. Bats test, call 999. Diabetes, remember right back at the beginning.
Give them sugar.
Provide them something to eat or drink. Yeah.
What if they're diabetic and they're unconscious? Should you, try and stop something? Yeah. What if they're diabetic and unconscious? Should you try and put something in their mouth or with their choking hazards? And
if you live or know somebody who's diabetic and they have these events often, you can get glucose paste. It's horrible. We had it on our first aid kits, so we had to try it. It was like wallpaper paste, and you rub it on the gums. But normally, you or I in the street, no, we wouldn't be doing anything. If they're unconscious, it's a 999 call. We only give them something if they can physically drink or eat. But as I say, if you do live with one, you could talk to the nurse, and it's this paste thing, and you put it in the mouth, and it soaks into the gums and helps them.
Okay.
Bleeding heavily.
Put pressure.
Where we're putting the pressure?
On the wound.
On the wound. Brilliant. Burns.
Running water for 20 minutes.
Running water for 20 minutes. Don't be like Judith. Head injury. Remember I said about something in your freezer?
Cold compress.
Cold compress. Apply something cold to the injury. Brilliant. Just a quick true or false. People may hesitate to help because they assume someone else will act.
True.
True.
Absolutely true. You should leave someone unresponsive and breathing flat on their back.
False.
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 CPR should only be performed by trained professionals.
False.
False. And you must stop CPR while the AED analyses the heart rhythm.
True.
Brilliant. Well done. So are you going to remember all that? Oh, first of all, before we decide if you're going to remember it or not, we will, I will post this into the chat. You can open it and it will stay open once this session is closed. It's our feedback form. So if you feel more confident now, well, if you don't feel more confident, if you could complete the form, it doesn't take long. You press submit, and just to let us know how these courses are going, if we need to tweak anything. Sources of support. There's a lot of talk about A&E, people phoning the ambulance when they don't need it, and you shouldn't. However, it puts people off phoning when they need it. If you have any life-threatening event, any of the things we've talked about today, you're out in the street and you've got somebody with a broken leg or whatever, you must phone 999, no matter how busy they appear to be. They will triage, they will put you in the right order. Choking, severe bleeding, you must phone 999. But there are other choices as well for other things, not the things that need 999. Right at the beginning, we've got self-care. And the reason we've chose hangover, grazed knee, sore throat, cough, is because people have turned up with at A&E with those. They're the people that hold things up in A&E. They have to be seen, they have to complete forms, and it holds things up. You can, even though you feel you're dying with a hangover, you can treat it yourself. If you're not sure what to do, again, if you're not sure and it's life-threatening, you phone 999. But if you're not sure on other things, phone 111. They are very good. They had a bad press in the start, but they are very good. Your local pharmacist knows loads of stuff. In fact, you can now, it's only 7 conditions, it's quite limited, but they can now prescribe for certain conditions without you going to the doctor. And I've put them in to the chat there. And there's a link to Pharmacy First that tells you all about it. So it does save you trips to the doctor. But they also know if you do need to see a doctor, if you go in and say, I've got this rash, what do I do? They will refer you to the doctor if you need to see the doctor. And of course, you've got your doctor that you can get in. Or if you're lucky, you might have a walk-in centre near to you. So there are other ways of getting help rather than panicking and getting 999. But I really emphasise, don't hold back from 999 if you think you need it.
We have community first responders here.
Oh, good. So you get quite quick response.
Yeah.
Brilliant. And also, if your town is in the middle of some major incident or thing, you may actually get a fire tender. If you say somebody's not breathing and every ambulance really is occupied, they might send a fire engine. They've got, I think it's 6 or 8 people on it who are all strong and trained, and they have a defib and oxygen. So don't be surprised if a fire engine rolls up. They will send an ambulance, but they will help you till the ambulance comes. Just a quick advert, we have another workshop called Supporting Connections. We also, hot off the press, have one now. You can sign in the same way you have for this. Flooding, preparing for flooding. I haven't taught one of those yet. I don't really want to, but never mind. You might get me again. Well-being. Your well-being or somebody you care about's well-being. There's lots of information at redcross.org.uk. Well-being support. Right, this is the one I wanted to get to because I'm really aware of the time. That is a genuine QR code. Now, I told you before, this course is for adults in Britain where response is quite quick, or similar countries where response is quite quick. However, you may be out and about, you may not have phone signal. We have 2 apps that are free. That's a genuine QR code, or you can go to, where's my link? Our website, download it from there, or you can go to your app store and put in British Red Cross First Aid, and you will be offered 2 apps. One's what we've been talking about, well, lots of things, more than we've been talking about today. Similar videos, short words, and the second one is children and babies. And that's where, if you've got children and babies in your life, you must look at the app because CPR is very different. You don't want to damage a baby by doing what I've talked about today. So I strongly recommend you download the app. If you don't want to download the app for any reason, the beauty of having it on your phone is if you're out and about without a signal, it's still on your phone. And if you've got no credit on your phone, you're still on your phone if you've already downloaded it. Plus, you should still be able to phone 999 if you've got no money or no credit, no signal. You should be able to still phone 999. So it's worth having your phone with the apps on. They don't take up much space. If you don't want to download the app, you can go to YouTube and put in British Red Cross, broken leg, British Red Cross, epilepsy, whatever you want. All the information's on there. I strongly advise you to put British Red Cross first, because sometimes people, either through mistake or even unpleasantness, they put the wrong information on. There's some things going around Facebook that are not really safe. So look for known providers, British Red Cross, St John, etc. If you go to YouTube, British Red Cross, and put the incident in, you will find help. But if you have it on your phone already, you don't even need a signal. So I'm just rushing because of the time, but thank you for being here. I'm happy to sit here and take questions or have a chat. I would really like you to fill in the evaluation form that I've put in the chat. I'll put it in again. But thank you for being here.
Okay, thank you very much.
Thank you.
Thank you.
Thank you so much.
Thank you.
Hi, Judith. Can I ask a quick question?
Yeah.
I was in a first aid situation a couple of weeks ago, which is what made me join this course.